Muy buenas tardes, bienvenidos al Consulado de México. Good afternoon, welcome to the Consulate of Mexico. First of all, I would like to thank Mayor Goodman for coming today and for her support to make possible this COVID-19 vaccine clinic. Without you and your staff, we would not be here serving the Mexican and the Hispanic community. I would also like to acknowledge the presence and constant support of Councilwoman Olivia Diaz. You are a true friend and an ally of the Consulate. Thanks for everything. Luis Aceves, our health partner and a true champion of our community, is here representing REACH and making sure this clinic runs smoothly. Last but not least, I must say that I'm very lucky to have the best staff. Their unwavering commitment to the Mexican community is really amazing. Muchas gracias a todos. We are about to finish a very successful COVID-19 vaccine clinic. 250 people were able to get, mostly seniors of the age of 65 and over. In a month, they will be here again for their second dose. And I look forward to seeing them again, because this is all for them. This is all for you. And remember, keep the prevention and take the vaccine when it's your turn. The vaccine is free of cost. No immigration questions are asked. The vaccination has nothing to do with immigration. Voy a decir algo breve en español. Les comento que estamos por terminar una exitosa jornada de vacunación contra el COVID. 250 personas pasaron o están pasando esta tarde por aquí. En un mes regresarán para su segunda dosis. Será un gusto volverlos a ver, ya que este esfuerzo es para ustedes. Todo es para ustedes. Recordemos que hay que mantener las medidas de prevención y vacunarse cuando nos toque. La vacuna es gratis y no tiene nada que ver con migración. La vacunación no tiene nada que ver con migración. And now, without further ado, I would like to introduce to you Mayor Goodman.
Pardon me for taking this off, but I think the message is so clear. And Consul General, this is so exciting for the people of our community, our entire city. Our Latino, our Spanish-speaking families have been for many years the fastest growing population that we have in Southern Nevada, and the most significant and the most challenged as far as jobs and keeping income and keeping their families together. This particular opportunity, and so wonderful to know this clinic is open, that REACH has made it possible here at the Consul. Because with this opportunity, there is the assurance, as told to us by health departments across the country and in other areas outside of our United States, that are finding these vaccines really preventative. And recently, having read about the success in Israel for those over 65 and soon to be others, it is absolutely important that we all get the vaccine. I come from a family of physicians. I have a physician son here whom I trust. And as the vaccines were being prepared, I asked an assurance from him here, what do you think about the vaccine? And he was extremely skeptical about it 6 months ago. But as time has passed and the data has come in from around the country, Moderna and the Pfizer vaccine really are a must for each one of us to help this community and around the country, wherever we travel, wherever we go, and our own families stay healthy and keep this virus at bay. It will help with the other strains of the virus, but I can assure you, being one who is well over 70, the first vaccine, all I had was discomfort at the site of the shot, And on the second one, to be perfectly honest with you, I thought they gave me either nothing or they gave me an energy pill. I have never felt better in my life and stronger, and know that all of us must communicate one to another to get the vaccine when opportunity permits it to be given to you. And each one of us should get a friend to sign up and call the consul and get registered to take the vaccine. It's a wonderful and important opportunity, and you need to do it for your families, for yourself, and for the whole community. So, Consul General, thank you very much for including me today on behalf of the city, along with Councilwoman Diaz, who's obviously extremely devoted to the community here. This is in her ward. Her ward has more going on in it than any other ward, I think, in the entire state, and she is so lucky. But it's because of the people, the culture, the language, the children, so much. And the city of Las Vegas, and Carolyn Levering, who is the head of our emergency management, and all our fire and rescue, and everyone else who is participating in this wonderful REACH program. And I just wish you constant success, and know that we must all be able to say one day soon, I have had my vaccines. So what a beautiful day we've created just for us. Where else in the country is it 72 degrees? And no rain, no snow, and aren't we lucky? So stay with it. And Carolyn Levering, I see, would you raise your hand over there, who has been orchestrating this for the city since the beginning, our ISOQ, everything that's been involved with helping to fight this virus. So thank you very much, and I give this back to you. Thank you.
Thank you very much, Mayor Goodman, for your kind words. And now I present to you Councilwoman Olivia Diaz.
Buenas tardes. Good afternoon, everyone. Thank you, Honorable Consul Julian Escutia Rodriguez, for the invitation to be here today. Thank you, Mayor, for those words and encouraging our community to get vaccinated. And thank you, Luis, for leading the charge with REACH and this partnership and making sure that we brought the vaccines to our people. I've been talking about the impacts in the community, the COVID-19 impacts in our Latino community now for months. We know that the Latino community has been disproportionately impacted compared to other communities. Why? Because a lot of our people are hardworking people who continue to go every day, show up for their jobs, and they're on the front lines, and they're making sure that we have food in our grocery stores. They're making sure that we have food to serve in our restaurants, and they're part of our working class, making sure that our casinos that are operating and are open continue to run smoothly. So with that comes exposure, and with that exposure comes the increased risk to come down with COVID-19. So yes, the vaccination is a light at the end of this tunnel for the 2020 pandemic that began almost a year ago. But we cannot let our guard down. We need to continue the course, continue to mask up when we're out in public. We need to make sure that we continue to get tested. If you feel symptoms of a flu or the symptoms that we've been talking about for COVID, we need to make sure that we still take the opportunity to get tested for free. And I think a lot of people still don't know about getting tested through Cashman Center, which is so important. Also, getting tested and knowing our numbers are coming down is going to be a positive sight with the number of vaccinations going up. Why? Because our kids are going to be able to partake in their everyday schooling activities. That's what I'm hoping for as a mom of a 4th grader, that my son can get back to his normal life, that people continue to be able to be called back to their work, because they're still being They're still waiting for that call from their employer to say, we're ready for you. And with that comes prosperity. So all of us want our economy to reopen. All of us want our schools to reopen, but we have to do our part. And our part is getting vaccinated when it's our turn, being patient. I know that it's been a struggle to try to get our 70-plus-year-olds, our 65-plus-year-olds scheduled for an appointment, but we must stay the course. And we need to make sure they follow up with their second dose. This is why I love this setup and this partnership with the Mexican Consulate and with REACH. People, it takes the guessing out of getting the vaccination. They can come here, get their first dose, they leave here knowing they're gonna get their second dose here, and they don't have to worry about where am I gonna chase down my second dose. So again, this is very, very powerful to be here today, and I think that we need to continue this kind of work. We want to bring this site to the community and make it as easy as possible for them to navigate. Y en español solo quiero decir que sabemos que como comunidad latina hemos sido impactados de una forma mayor. Como comunidad hispana nos ha dado el COVID-19 más que a cualquier otra comunidad. Así es que por eso es importante que hoy día estemos aquí concientizando a nuestra comunidad de que se vacunen, porque la vacuna es parte de la solución para reabrir la economía, para reabrir las escuelas. Muchos de nuestros padres están esperanzados de que ya puedan regresar sus hijos pronto a las aulas escolares, pero todavía no nos vamos a sentir al 100% cómodos a menos de que estemos vacunados y tengamos una protección mayor de la que tenemos actualmente, implementando el uso de las mascarillas, lavándonos las manos frecuentemente y también guardando la sana distancia. Todo eso no va a desaparecer con la vacuna. Y quiero ser clara porque muchos de nosotros pensamos que en cuanto nos vacunamos ya es la inmunidad total en contra del COVID. Ayuda, pero no significa que no me pueda dar. Así es que es algo que nos va a fortalecer como comunidad, va a permitir, como de nuevo, que mucha gente regrese a trabajar en mayores números, que nuestros niños regresen más pronto a la escuela, pero nosotros tenemos que hacer nuestra parte y nuestra parte es ser vacunados y llevar y facilitar el proceso para muchas de las personas en nuestras familias, nuestras amistades, nuestros vecinos. Sabemos que es difícil navegar el internet. Para hoy día muchos tuvieron que apoyar a sus papás, a sus mamás, a sus abuelitas, a sus padrinos para realizar esta cita por medio del enlace de REACH. Entonces yo quiero otra vez, por favor, pedirles a todos los que tengan la posibilidad de ayudar a alguien que lo hagan, que por favor les pidan si necesitan asistencia registrándose, si necesitan asistencia llevándolos a donde les toca la vacuna, si necesitan asistencia llenando el formulario que se pide cuando se presentan aquí en el proceso de registración. Esto realmente es un esfuerzo comunitario y por eso estamos aquí en la ciudad de Las Vegas, el Consulado Mexicano y REACH, la ventanilla de salud, para apoyar a nuestra comunidad y respaldarlos, porque todos debemos de tener la misma protección. Y si muchas otras comunidades tienen acceso a la vacuna, vamos a seguir nosotros tratando de obtener el acceso para nuestra comunidad, que bien sabemos ha sido muy impactada por el COVID-19. Así es que muchísimas gracias por estar aquí, corran la voz y vamos a seguir manteniéndolos informados de otros sitios de vacunación que va a haber próximamente para nuestra comunidad.
Thanks very much, Councilwoman Olivia Diaz, for your message and your kind words and the call to get the vaccine. And now I present to you Luis Aceves. He runs our Ventanilla de Salud, our Health Resource Center with REACH. Please, por favor.
Good afternoon, everyone. Buenas tardes. Welcome y bienvenidos. Consul Julián, thank you so much for your support. It's an honor to collaborate with you. Consul Julián, es un honor colaborar con usted y tener su apoyo. Mayor Goodman, REACH has you in our hearts. We really appreciate your support. La tenemos en nuestro corazón, en nuestra organización y realmente agradecemos su apoyo. Councilwoman Diaz, I don't have words for all the support that you gave us. No tengo palabras para agradecer, Consulwoman Diaz, todo el apoyo que usted nos ha dado. I remember that time that I told you please don't forget us, and you never did it. Yo recuerdo aquella vez que le dije que nunca nos olvidara y usted nunca lo ha hecho, because you are looking for the wellness for your people and for everyone. We are proud that a Latin American, a Hispanic woman like you are representing us, and it's really an honor. En verdad agradecemos el apoyo que usted tiene a Reach siempre. First, I would like to say thank you for the trust from our Hispanic community in our organization. Primero quiero dar las gracias porque la comunidad hispana cree en Reach como organización. Since the beginning of the pandemic, we have been attending a lot of people. At this point, Reach, through all their programs, we have attended 120,000 Hispanic individuals in the state of Nevada. Hasta el momento y desde el principio de la pandemia, Reach, a través de todos sus programas, ha atendido 120,000 personas de habla hispana en su mayoría. This is the beginning. We have a light of hope right now. But this is not the end. We have a lot of work to do. And we need to do it together for them, for our people. We are a puzzle, and each piece is so important to complete it. Esto es el principio. Tenemos una luz de esperanza ahora, pero realmente necesitamos continuar trabajando porque somos un rompecabezas y cada pieza es importante. We will keep working. We're going to continue our work, educating our people about what is the COVID, prevention, testing, the COVID-19 vaccine. We need your support. We need to support each other. Vamos a continuar con nuestro trabajo educando, hablando del virus, hablando de la vacuna, resolviendo todas estas dudas. There's a lot of people afraid about to get the COVID-19 vaccine. There's a lot of people that they just have been waiting for us to have a vaccination date to come to get it. Hay mucha gente que tiene miedo a la vacuna. Hay muchas personas que han estado esperando a que Reach tuviese una jornada a través de la ventanilla de salud o de cualquiera de sus programas para poder venir con nosotros y confiar en ponerse la vacuna. We need your support. We need to keep working out. Necesitamos el apoyo de todos y necesitamos continuar trabajando. To all the people that trust in our organization, in Ventanilla de Salud, that we're able to attend everyone. It doesn't matter where they're from. We receive everyone. A toda la gente que ha creído en nuestros programas como Ventanilla de Salud, en donde recibimos a personas de donde quiera que sea su origen. La Ventanilla de Salud, gracias al apoyo del Consulado de México, nos da la oportunidad de atender a mexicanos y también a personas de cualquier otro país. This is the way that Mexico opened their arms to get help to all the people, to everyone. Esa es la manera en la que México le abre los brazos a través del programa Ventanilla de Salud. For all of you, all the media, honestly, guys, you here with your hard work, thank you so much for supporting us, spreading all this message. A todos los medios de comunicación queremos agradecer el apoyo que nos han dado para poder difundir toda esta información. And today I would like to say a special thank you for all our volunteers, all the people, the fire and rescue people, the city of Las Vegas people, the Mexican Consulate people, all the volunteers since yesterday. We did not stop. Thank you so much. Without you, this is not going to be possible. Agradecer a todos nuestros voluntarios de una manera muy especial. A toda la gente de la ciudad de Las Vegas, al Departamento Fire and Rescue, a nuestros compañeros del Consulado de México. Sin ustedes, esto hubiese sido imposible. Today, yes, we provide the first dose. But today, Reach One wants to touch your hearts. Reach change lives with the support of the Mexican Consulate and the city of Las Vegas. That is our main goal, to see for our community, to look for the wellness of our people, Our main goal is to change their lives. Hoy sí colocamos una primera dosis. Hoy estuvimos trabajando arduamente para que esto fluyera y se llevara a cabo. Pero nuestro principal objetivo es que hoy hemos tocado los corazones de las personas. Hoy verdaderamente hemos cambiado las vidas y este es el principal objetivo de nuestra organización a través de todos los programas. Thank you so much. Gracias.
Thank you, Luis, for your very warm message from the heart. Truly sincere. We have some time to take questions, so if you have, Victor, the microphone, if you have a question, feel free to do it right now. Or if not, yeah, here.
I have a question to the mayor. This is a request from the mayor. Seeing here in the city that is the Hispanic population is one of the highest ethnicities with rate of COVID-19. How important is for you this effort of making possible that many Hispanic people, some of them that might be undocumented, get vaccinated?
Without equivocation, the Latino community has been the backbone of the growth of this entire industry. Our hospitality industry and our entire lifeblood. And so it is critical that as we begin to open back up our city, everybody's healthy. And that doesn't just mean elderly like myself, it means next generation. And in time, we will have vaccination, I am sure, for the entire community. We are part of a greater country, and here and what we do is an example. In Las Vegas, there were one people, we're one family, and each one of us needs to make sure that we represent all of us together as we move forward. So having our base of the hospitality industry, which is largely the Latino population, it is critical that we are all telling each other, get the vaccine so you can be healthy as we return to business. I love your question.
My question is for Ms. Olivia Diaz. My name is Sally Jaramillo with Channel 8, and we want to talk more about, obviously, the efforts of kind of breaking out those misconceptions within our Latino community. Just today, talking to people, I became aware of how still they were nervous and a little bit scared to take the step. When they came out, it looks like they definitely felt new. They felt like they could breathe again, some relief. But once again, what are we going to do to continue to push out this effort to break these, you could say, these myths that we're hearing out there from others in our community, and maybe are making some of our community members very hesitant when they're coming to take this step?
Well, I think that today is the first great step to show that members from our community received the vaccination. Nothing happened to them. If anything, now they are going to be more protected against COVID-19. And just because you've already gotten COVID-19, I think that a lot of people in our community think that I already had it, so I don't necessarily need the vaccination. And that's one of the myths that we need to really address, that you have immunity, but only for a certain window of time. And then you are, just as everybody else, likely to have it a second time if we don't take matters into our own hands to remain protected. But we need to just ensure that we're conveying this information. I know that this past weekend, I received a text message from a friend. He had been advocating the vaccination to his elderly mom, and he then sent me a thank you. And I said, why are you thanking me? And he said, because my mom just relayed to me over lunch that she had received a phone call urging folks in your community to get the vaccination because we had a previous clinic at Chuck Minker. And we were making these phone calls and we were urging folks to know that these vaccinations were there, that they were accessible to the community. And she heard our call and she made that step to get the appointment scheduled. And she went and she got her vaccination. So as you can see, all of us play a role. Our children advising their parents to get it, but also it's up to us public electeds also sharing in the message that we need to ensure that everyone receives this vaccination, that we don't need to be scared or afraid or take certain things that are posted on social media for truth, but we really need to just continue to show through real life experiences like our comadres, our padrinos, just different people in different walks of life that they're starting to get it and that nothing is happening to them, I think will hopefully help us make better speed and progress in helping our community understand that this is a positive, not a negative.
And I know in African American communities, they were relying heavily on pastors to bring out this message. How are we communicating with our religious leaders when it comes to getting the vaccine as well here?
As soon as I know about a vaccination clinic coming in close proximity to my ward, I do reach out to those faith leaders. We have so many from so many churches, so we try to make sure that they know where the vaccination clinic is so that they can also help us spread the word, because I think faith-based leaders play a very important role. I know that Catholic priests have been sharing their pictures on their social media platforms showing that they're getting vaccinated, that it's something safe to do, and I'm sure other faith leaders are doing the same. And it does take the whole village to raise up our voices and say this is something we need to do.